with more.
From outdoor jobs to shoveling snow, even tailgating for your team. Winter in New England doesn't mean you're stuck indoors.
When we go outside, we get cold, we kind of feel numb a little bit. But about 10% of the population, or 1 out of every 10 people, has a reported increased sensitivity to the cold.
If you don't warm up quickly, that can lead to frostbite.
The tissue actually dies because it's frozen. If you get frostbite, you actually may end up with finger amputations.
Dr. Kelly Johnson Arbor at Hartford Hospital tells us frostbite can happen to anyone, but for others, there are other medical conditions to look out for.
If you have frostbite, for example, you'll have all of your fingers and toes cold at the same time because they're all exposed to the same temperatures. If you notice that one leg, for example, is colder than the other or looks different than the other, that may be a problem with your circulation. So that would be something that you should have your doctor look at.
And another medical condition.
There is one condition called Raynaud's phenomenon, where people's fingertips actually turn blue when they get exposed to cold.
Most susceptible to the cold, your fingertips, your toes, your ears, and the tip of your nose. So make sure you bundle up, put on your gloves, make sure you have good boots on, and don't forget your hat or your earmuffs.
Your body's reacting to the cold weather, and your body's trying to conserve heat. So it's going to conserve heat where it needs it the most, which is going to be your heart, your brain, your bigger organs. So it will actually constrict the blood vessels in your fingers and kind of keep the blood closer to your heart. The most important thing to do is prevention, really. So if you know that you have this condition, or if you know that you're sensitive to the cold, you really want to try to keep your fingers and toes as warm as possible when you're exposed to the cold. So wear loose-fitting but warm clothes, mittens, gloves, socks, boots, anything to protect your hands and fingers from getting cold.
With your health, I'm Irene O'Connor, Channel 3 Eyewitness News.